Most of us know Dr. Gutman very well, and we know many of his, his accolades. But for those of you who may not know who Dr. Gutman is, I'd like to just take a minute and kind of give you some background on him. Dr. Gutman is a board-certified physician, and he's got extensive experience in academic, administrative, and clinical medicine. He got his medical degree in Calgary, and then went on to Emory University in Atlanta, Georgia, where he studied emergency medicine. In fact, he was a chief resident in emergency medicine at the Emory University. He was the undergraduate director and residency training director of emergency medicine at McGill University. So again, now he's teaching other doctors about emergency medicine. He served on the board of directors of the Canadian Association of Emergency Physicians, as well as numerous other academic associations. He has trained literally thousands of doctors and students in his career. But when it comes to glutathione and health and illness, his expertise in this has led him to spend the last quarter century lecturing across the world on this topic. He is heard often on radio, television, and the internet, and is the author of the best-selling medical book, now in its 5th edition, on glutathione, which is widely regarded as the cornerstone publication and reference into the scientific investigation of this remarkable substance. So as you can tell, Dr. Gutman is well known around the world, and he is responsible for educating many, many people on the critical role of glutathione in health. So we're very honored and pleased to have him join us on this call. So Dr. Gutman, welcome to the call.
So tonight we're going to discuss a very important topic. I was going to say that this topic affects half of our population, but clearly it affects much more than that. Women's health issues will also affect indirectly most men as well. And aspects of women's health go far beyond what we used to be considered the realm of women's health, that being gynecology and obstetrics. Several of the main issues of women's health have been dealt with in previous lectures. Cancer certainly is a major issue, so please try to access that topic in our archives. Pregnancy has been well covered, so look that up as well. You should be able to find it easily. Heart attacks, well, I mentioned heart attacks because that's one aspect of women's health that are diseases that present differently from those in men. In heart attacks, picking on symptoms and signs can be quite different among the sexes. This has only recently come to light, as we used to be focused mainly on the male in our medical diagnosis. And of course, urinary tract infections and other diagnoses are more commonly found in females. But today, we're going to limit our presentation to just a few issues in women's health, those being female infertility, polycystic ovary syndrome, osteoporosis, menopause, endometriosis, fibroids, and polyps. These are all common issues and for sure will have or still affect many of our listeners today. Let's first look at female infertility, a very common problem. In fact, in the USA, it's estimated that at least 10% of females will present to their doctors with this complaint. Now, this is a high figure indeed. Female infertility is easily defined. It's either an inability to get pregnant after at least 1 year of trying, or an inability to remain pregnant because of frequent miscarriages. Both of these can be extremely frustrating. The causes are many. There can be problems with ovulation. Ovulation is the release of an egg which can then be fertilized. This can be affected by hormonal irregularities, which is quite common, or by things like infection, especially chronic infection that's seen in what we call pelvic inflammatory disease. Polycystic ovary syndrome is also a contributing factor, and we'll deal with PCOS a little bit later on. There's something called POI, or primary ovarian insufficiency. This is when the ovaries prematurely stop working. Of course, there's the idiopathic category, which is a fancy word for saying we don't know why this happened. And a word of warning, both smoking and drinking alcohol can be a contributing cause. And there are many other reasons as well. So a primary question that needs to be asked is, are glutathione levels lower in women suffering from infertility? This is actually easily answered. In this study, samples from the follicular fluid were collected in both fertile and infertile patients and compared. And it was clearly shown that glutathione levels were significantly depleted in the infertile group. Glutathione levels in the affected tissues were lower. Does this study stand alone? Absolutely not. There are dozens of papers that have demonstrated the same. And these have looked at glutathione levels in different tissues, including whole body glutathione levels. Another question that is interesting, glutathione genetic abnormalities correlate with female infertility. These days, it's becoming easier and easier to do glutathione gene testing. And again, it's easy to find a plethora of articles that demonstrate that abnormal glutathione genes lead to relative infertility. Finally, it's well known that chronic infection, or what we call pelvic inflammatory disease, has a high association with infertility. This is an all too common problem representing a significant portion of female infertility patients. In this European study, serum samples were collected from women with tubal factor infertility, or TFI, those with multiple spontaneous abortions, and fertile women. They tested for chlamydia antibodies as well as for antioxidants, including glutathione. And as suspected, they found a strong correlation between chronic chlamydia infection and lowered glutathione levels in the infertile group. Another important demographic to consider. So now let's move on to polycystic ovary syndrome, or PCOS. This is actually a rather common problem that many of you listening tonight, you have this, but you're still yet undiagnosed. Women typically have two ovaries, as shown in the screen, each about the size of a ping pong ball. Now, these reproductive organs produce ova, or eggs, that are released into the uterus each month, ready to be fertilized. Now, polycystic ovary syndrome, patients develop cysts on their ovaries, hence the name. It's called a syndrome because there's a spectrum of different things that may occur. Primarily, the problem is due to the overproduction of male hormones in women. The major issue is menstrual irregularities and, of course, infertility. Besides these problems, there are a number of other metabolic changes that can affect these women and the way they look. Certainly, weight gain is a big issue. Many, if not most, of these women are overweight. There are changes directly due to the increase of androgens or male hormones. These women often have hair growing in places normally only seen in men. A hairy chest or a mustache is not uncommon. Acne is also regularly seen, as well as thinning of the hair. The definitive test is a pelvic ultrasound, but these patients can often be picked up just looking at a crowd. So again, the male hormones cause changes that lead to women taking on male characteristics like hairiness and acne. But there's also a problem of excess insulin production, which leads to weight gain and even diabetes. We'll soon see why this is important. Getting back to the basic question, do these patients suffer from decreased glutathione levels? Study after study have shown that both oxidative stress is increased and glutathione activity is decreased. This is undebatable and very clear. Not only has glutathione deficiency been clearly demonstrated, but glutathione levels have been shown to correlate with the severity of the disease. For example, levels of glutathione are related to the degree of abdominal obesity, waist size, insulin resistance, and hirsutism. Hirsutism is another word for hairiness. So we know that glutathione levels are low in polycystic ovary syndrome, but the important question that remains is, can raising glutathione actually help this problem? Let's look at a few studies. Here we have what we call a meta-analysis looking at NAC to raise glutathione levels in polycystic ovary syndrome. A meta-analysis is when you pool separate studies together to look at their overall outcomes. Here are 8 studies corresponding to over 900 women was used. It showed a definite advantage in improving pregnancy rates as well as ovulation in PCOS by raising glutathione. Very promising. Here's another interesting study. The classic diabetic drug called metformin, okay, is often used to treat polycystic ovary syndrome. Here, metformin went head to head with the glutathione enhancing drug NAC, or N-acetylcysteine. The results showed that raising glutathione this way essentially had the same success rate as the metformin group. Both groups showed an equally large improvement in egg and embryo quality. A similar comparison was made here between glutathione enhancement and metformin. Here, they had a surprise. The glutathione group actually had better improvement in their lipid profile, their fasting blood sugar, and their blood insulin levels. This is quite outstanding. So let me summarize the benefits of raising glutathione in polycystic ovary syndrome. Clear improvement in fertility, clear improvement in insulin metabolism and blood sugar, clear weight loss, clear improvement in the masculinization effects, such as hairiness and acne, just a whole lot of ways in which you can help here, folks. Let's look at something completely different now. Osteoporosis. Not strictly a female problem. It appears in many men as well, but is much more prevalent in women and starts at a much younger age. Male hormones are preventive against osteoporosis, so rates in men only start to catch up to women after about age 70, when men's hormones production drops. Osteoporosis happens in stages. At first, we all start off with healthy and dense bones with a tight network of what is called trabeculi. The inside of the bone, or the trabecular network, is actually filled with little pockets like a sponge. And as we age, there's a tendency for this spongy layer to become less dense, and the pockets or holes get larger. At some stage, a person will develop what is called osteopenia, which means thin bones. If the process continues, we develop full-blown osteoporosis, or holy bones, holy as in full of holes. This makes the bone much more fragile and far likelier to break. Finally, a person can go on to severe osteoporosis, where breaking a bone becomes much more likely after a fall or even mild trauma. There are many factors that encourage the development of osteoporosis. Certainly, lack of exercise is one. The strains put on your body by exercise actually strengthen your bones. In fact, being of a slight or skinny build increases your risk, as heavier women have stronger bones because of the stress put on by supporting more weight. Smoking, drinking alcohol, having too much coffee are all risk factors as well. Diet, genetics, and hormone imbalances are also causative factors. Please note that you see that the bottom right over there, that last item shown in the corner, oxidation. Yes, oxidative stress is a medically recognized risk factor for the development of osteoporosis. So why does treating oxidation not show up in most recommendations on treating osteoporosis? Of course, we have medications that build up bones. We know the importance of vitamin D and calcium supplements. We understand the role that a healthy diet and exercise plays in helping. Where is treating oxidation on these charts? Well, certainly there's more than plenty evidence that oxidative stress is at play. And more importantly, that glutathione deficiency is documented in this group of patients. This has been shown years ago. And what about papers that show that raising glutathione can help? Do these exist? Well, you know the answer. Of course they exist. Raising glutathione acts in osteoblasts, and osteoblasts are these little cells that produce bone, to reduce bone breakdown and promote growth. In fact, an old Japanese study on immunical showed the same thing. The authors are quoted as stating this strategy can lower the threat of osteoporosis. So the charts describing treatment of osteoporosis fail to show raising glutathione as a way to deal with osteoporosis. But that doesn't mean that you can't make this point. Here's something that is unique to women: menopause, a problem that varies in its severity and its intensity, but will affect every woman to some degree if they live long enough. We speak of menopause, but again, it's a gradual process with different phases. Let's start with premenopause, when things are going as they normally are, with normal hormonal secretion and normal estrogen production. Of course, estrogen is the main female hormone, but somewhere, usually between the ages of 45 and 50, estrogen levels start to fall. And this is the phase we call perimenopause, where you still have menstrual periods, although they may become more erratic. This is when typically you may suffer from hot flashes, night sweats, weight gain, and other symptoms. Finally, your periods stop and you enter full menopause. Now, other issues increase, like vaginal atrophy, depression might happen. Breast cancer risk goes up. Finally, the post-menopause phase evolves where medical problems like heart disease, urinary tract infections, osteoporosis all become much more common. Menopause can cause a huge spectrum of symptoms and complications, changes in mood, changes in sleep patterns, changes in body shape, thinning of the hair, just a whole lot of reasons that can cause distress in the person going through this. More serious problems, of course, include the development of osteoporosis, which we just mentioned. Again, heart disease also becomes more prevalent. It seems that active female hormones are somewhat protective against things like heart disease and osteoporosis. Certainly, a lot of changes for the aging woman. Again, we see a clear correlation with glutathione levels associated with menopause. The highest levels of glutathione are seen in young, fertile women. They progressively fall with age, most dramatically with perimenopause, and reach their lowest point after menopause is well established. And again, this has been shown in multiple studies, not only with blood serum levels, but also in uterine and endometrial tissues. An important point that needs to be made is that menopause and the concurrent drop in estrogen levels all increase the risk of specific diseases. Now, here you see a list of some of these heart disease, sleep apnea, obesity, metabolic syndrome, which is a combination of high blood pressure, high blood sugar, and high cholesterol. This contributes significantly to illness and mortality in older women. But look at this. All of these, yes, all of these are associated with glutathione deficiency. And there are many studies that have examined the association of the loss of estrogen with the loss of glutathione. This is of critical importance. So pay attention to glutathione and menopause, and the best time to start to correct this is before menopause. Let's move over to looking at problems that occur within the uterus. And these problems can happen at any age. Let's start with endometriosis. Some women develop uterine tissue outside of the uterus, on the ovaries, on the fallopian tubes, on the bowel or bladder. This causes problems, and this is called endometriosis. During menstrual periods, blood from this misplaced tissue leaks into surrounding areas and causes pain and discomfort. So the main symptom of endometriosis is pain. This can be pelvic pain or back pain or abdominal pain, all depending on where this abnormal tissue is located. Endometriosis patients also are prone to heavier periods and bleeding between periods as well. So treatments include pain relievers, hormone therapy, and even surgery to remove this excess tissue. Is glutathione suspected as playing a role in the development of endometriosis? Again, this has been shown to be the case in several studies. Low levels of glutathione are correlated with the development of this disease. Furthermore, it seems that raising glutathione can lead to suppression of growth of endometrial tissue, again, showing the potential role of glutathione augmentation. Finally, this study from Europe was carried out in almost 400 patients with endometriosis. It showed that raising glutathione in endometriosis led to a statistically significant improvement in endometriosis-related pelvic pain and required a lower intake of rescue pain relievers. So raising glutathione decreases the pelvic pain from endometriosis. Finally, let's take a look at two more related conditions, uterine fibroids and uterine polyps. The uterus can overgrow and develop both cancerous and non-cancerous masses. Overgrowth of the lining of the uterus can produce polyps. These are balls of tissue connected by a stalk or a stem, and these have a tendency to produce heavier periods and more bleeding. Unfortunately, they are also prone to becoming cancerous. Overgrowth of the muscular wall of the uterus can lead to the formation of fibroids. Fibroids can range in size from a pea size to really very large masses. They can be single, they can be multiple, and they commonly cause heavy periods or excessive bleeding. These are very, very common, with most women having them after about the age of 50. Polyps and fibroids are usually left alone without treatment. However, polyps are often treated more aggressively since they are potentially malignant. They are often treated surgically. Fibroids, on the other hand, are only treated if they become too problematic. And the usual approach is local surgery or even a full hysterectomy or removal of the uterus. It's becoming more and more common to access a person's genetic profile. We've gone so far in our ability to do this quickly and cheaply. One thing to note is that women who have genetic abnormalities in their glutathione are at higher risk of developing fibroids. This is an indication that poor glutathione function is associated with the development of this problem. And of course, it's been found that glutathione activity is abnormal in women with fibroids. So we've looked at a number of female health problems today: infertility, polycystic ovary syndrome, osteoporosis, menopause, endometriosis, and more. All of these are associated with abnormal glutathione levels. Based on this fact, I believe there is great potential in raising glutathione levels. There are a lot of women out there that can use this strategy. So thanks once again for your attention, and I hope you picked up some great points tonight.